Today's topic is the medical professional presentation on the uses of CBD for pain management. Dr. Blair, if you could just introduce yourself and speak a little bit about your background and how you got involved with Elixinol and learning about CBD. If you could just share for a couple minutes about that.
I worked as a family physician. I trained in family practice, delivered my quota of 1,000 babies, took care of the infants, and addressed all manner of illness, as well as operating as a wartime medic, as DISCOM surgeon during the Gulf War. After 25 years in the service, I have seen quite a bit of stuff. I have explored many of the traditional pathways of medicine and medical practice, board certified in family medicine as well. A couple years ago, while I was working, I discovered the cannabidiol. After being introduced to it and seeing some of the results that were coming from it, as well as exploring the literature, I realized what an enormous boon this would be for the entire world in terms of bringing a control of so many of these major health problems with cannabidiol. So I'm delighted to be able to associate myself with Elixinol, and I learn from every encounter that I have with people using CBD, as well as learning from patients and what benefits that they're experiencing.
Wow, that's great, Dr. Blair. I appreciate the background on that. So I'm curious, for today's topic, we're here to talk about pain management. I know one of the things that you've actually been working with a number of your patients on is specifically around pain management. So if you don't mind, share just a little bit of a background of consequences of chronic pain and how that's affecting people on an individual and also collective level.
Chronic pain is becoming more and more in the news. We're seeing news publications, events happening of people dying. Like Prince died of an overdose-related problems, and we have, of course, an epidemic, really a pandemic of drug abuse, whether it's prescription opioids for people trying to manage their chronic pain, or it's heroin. So there's a huge problem going on with respect to the uses of pain medications. Assumedly, it's because these people are having pain. The effects of chronic pain are enormous in terms of the morbidity and mortality that's going on. First off, it's in a very, very expensive. We're talking a $1 trillion business or economy. Based just on pain and management. And then that's not even really to mention the impairment and disability that goes along with having chronic pain. People just are not able to function. They retire and leave the workforce earlier, and they become a major burden on society as well. In addition, there's the addiction and the depression. We're seeing quite a bit of an increase that's going on in suicides. So all of these things are going on, and the consequences of the chronic pain are enormous, and they touch everyone's lives.
Yeah, it's such a shame that more and more we see this in the news. Like you mentioned with Prince recently passing away, and there's just more and more people. I understand the statistics are just incredibly alarming, the number of people that actually legitimately start taking pain medication because they have a real issue. And then unfortunately, they have highly addictive properties. I recently had a spine surgery and I was given Percocet as a prescription pain medication. And they literally, when I went to the pharmacy to pick it up, they had me sign off, and the pharmacist wanted to tell me that it was extremely habit forming was the specific vernacular that they used. For some reason, they didn't want to use the word addictive. And she wanted to let me know that. So, I can definitely see, and I've heard stories of people. Unfortunately for myself, I actually ended up only taking the Percocet for 24 hours instead of the 30-day allotment that they gave me.
Well, you may be the exception, Doug, because a lot of people get started on it and they find a relief initially, but then they get involved in this vicious cycle that says, well, it's not working for me after a couple days. I need to take more and more and more. So they're taking larger and larger amounts, and then that does not prevent them from developing side effects just because of the tolerance. And so they'll get constipated, they'll get cognitive blurring. And then if you look at what happens societally, what we see is these people become immobile, they become impaired, they're cognitively impaired and physically impaired. And so then there's a diminishing of their self-worth, social limitations, And then that actually leads to worsening pain. And they enter into a psychology of pain. And then the pain becomes something that is a sort of a mantle that they wear on their shoulders.
Yeah, it's amazing you bring that up. We're showing the slide now that actually has how chronic pain is multifactorial, and you had mentioned this in a previous conversation that we had. And it's amazing the number of different effects that people will have in their life, that oftentimes it's really pain that's the contributing factor to these experiences, whether it's depression or insomnia, inability to concentrate, the fatigue factors that may be there. And one of the things I'm curious about, there's this statement that you can take a frog and put it in room temperature water, if you put a frog in boiling water, it jumps out right away. Although if you put a frog in room temperature water, and you start to heat the water up to where it boils, it will actually stay in the water until it boils to death, because it doesn't notice the subtle fluctuations in temperature. And my curiosity, at least for myself and for other people, is oftentimes we may have a low level of pain that we're not even aware of, and it becomes worse and worse over time, and it has all these negative effects, and we're not even aware that it was actually pain that was contributing to that.
Oh, you're exactly right. The pain, we usually think of pain as simple pain, and that's the layperson's view of it. I've got pain, therefore I need to treat it. Well, that's a simple idea that you get a stimulus that happens on your finger, and then it goes up to the brain, and okay, I need to treat that. I need something to reduce the pain on that because it's really interfering with my ability to function properly, either to use the hand and the finger or to think cognitively. But as you've pointed out, it's many more ramifications. And really, when you get to chronic pain, this thing becomes quite pervasive towards all of the system, whether it's sleep or it's thinking ability, or it's fatigue, or it's depression. All these things are a ramification of the chronic pain, leading to these other types of impairments. On so many different levels, on a physical level in terms of inflammation, as well as on a cognitive level in terms of depression, and this insomnia that goes along with that. So, and typically your average physician is treating just the pain. You're having pain, let's take care of the pain. And they don't look at these other issues that are going on. And it's so important that these other issues be addressed, especially in chronic pain, because they can lead to that vicious cycle that we talked about earlier.
Now, Dr. Blair, you had also mentioned that pain actually has other challenges. And I remember one of our previous conversations, you were mentioning that it really affects the pain perception only, and obviously the other adverse effects that we were talking about. If you could just speak into that for a moment.
Well, the way that pain medications typically work is on the pain perception. So that means that if you burn your finger, you're getting a pain sensation that's coming up through the neurons and it's going to the brain. Your typical pain medications are going to interfere with that pathway, typically using the opioid receptors that are on the nerve cell. And that sort of stimulus is a very simple, direct effect that's happening there. And our answer in the current therapy is that, okay, let's use something to dampen or interfere with that opioid receptor pathway and that pain. And so we use pain medications. The problem with using pain medications alone is that that's all that they work on. They have adverse side effects. There's tolerance issues. There's impairment and addiction and overdose, but none of the things that we were talking about earlier. So we miss all of the other effects typically with chronic pain. And really what we're talking about, Doug, here is chronic pain. When you had the surgery that was short-lived in terms of the pain that you had, you were able to recover quickly from it. But just imagine if you had that pain for the rest of your life, what would happen to you? And our current addressing of pain treatment is really focused on just that pain perception. And then there's some modifiers that they're adding in that also have significant adverse effects.
Wow. Well, I appreciate that. Now, you had also mentioned the overall, and if you could just talk into this, the opioid pain system and what that relationship is and how it works.
Well, the opioid pain system is essentially what you get with your narcotics. It's what you get with even the non-steroidal anti-inflammatories are interactive there in terms of reducing the pain stimulus. So these are really our pain sensitivity areas that are going on within the body. And they're concentrated in a number of different areas. Of course, they're always in nerves. And they're located where there's a lot of nerve activity. So it's in the brain, it's in the spinal cord, and it's occurring in the intestines. I mean, it's oftentimes we overlook the fact that the intestines has probably got even more neurotransmitters in the brain, far more neurotransmitters in the brain, and is a very sensitive and very active neurological area. But the opioid pain system is in all of these nerves. It's picking up on all of those sensations, and it's interacting with the environment at the cellular level.
Wow. So, if you could also then, as a transition, to talk about the endocannabinoid system and what you've learned and what science is starting to discover about its relationship with the body and with pain.
Well, it's really quite fascinating because, of course, the endocannabinoid system is a totally new system that has not yet been taught in medical schools. And so very few doctors are really familiar with the scope and the dimension of the endocannabinoid system. But we're really talking about the master controlling, fine-tuning mechanism of the entire body and all of the subtle systems that we have. So we're talking about the neurologic, the endocrine, the immune, the behavior, the cognitive function. All of these things are closely tied to the endocannabinoid system. And the endocannabinoid system is modulating. It's making small adjustments and small corrections so that we can maintain a normalcy, a homeostasis. Well, that's great. Well, on a cellular level, the same thing is happening. But on a cellular level, it's using receptors that are actually quite similar to the opioid receptors. And so there's these cross effects that can occur. Now, if we look at, and if you just go back a slide, so if you look at the endocannabinoid system as being involved with the certain types of lipids as well as receptors in all tissues, but in addition to the endocannabinoids, the one that we secrete naturally, there are also cannabinoids. The endocannabinoid system is also affected by a number of other things that we just really haven't been aware of, but we're discovering that many of the drugs that we use in current formulary are actually working on the endocannabinoid system, especially the ones that we didn't know why they were working. Typically, it turns out that they are working on the endocannabinoid system. Foods affect that. Things like echinacea are actually working on the endocannabinoid system. Truffles actually stimulate the endocannabinoid system. That's why they have such a pleasurable effect for some people. And activity. We used to think that endorphins were giving us the runner's high, but in fact, the endorphins cannot cross the blood-brain barrier. So the only thing that could possibly provide that high, that satisfaction or that feeling of health, is actually coming from the endocannabinoid system. Now, in addition to the natural things and the foods and the drugs that we're using, it turns out that the phytocannabinoids, the ones that are coming from plants, can also affect the ECS system. So we got a broad range of effectors. A lot of the things that we disregarded, we didn't know what was going on, are actually affecting this particular system and making changes in the body.
Wow. No, I appreciate you sharing that. And anything here on this specific slide, as far as information that that we haven't already covered, or did you cover a lot of this already?
Well, I think this goes for a broader coverage of the endocannabinoid system. It tells you about the number of different areas that are involved, and we're still discovering many, many more. Just suffice it to say that it really covers the entire body in terms of any of these regulatory functions that we were pretty fuzzy about. How do they happen? How are they controlled? Is actually the endocannabinoid system is likely involved. It may not have been revealed yet, but the research is ongoing and continuous in terms of finding these connections.
Wow. And then Tell us about the relationship between the opioid and the endocannabinoid receptor interaction.
Well, it turns out that the opioid receptors and the endocannabinoid receptors on nerve cells actually are co-located. They are within a few microns of one another. And what we're seeing is that they are interactive. And so that the endocannabinoids and the opioids are working together and providing both the beneficial and the adverse effects. And when I'm talking about adverse effects, it turns out that the cannabinoid receptor number 1 actually controls the opioid reward and addiction factors, the behaviors that are involved. In some tests, they've shown that sugar actually comes through the CB1 receptor control mechanism. So we're seeing a blend of these two particular areas. And here I have a picture of a brain. I know that looks like a frog, but it's in fact it's a diagram of the brain. And what they've done is to overlap the two types of receptors and showed where the opioid receptors are concentrated as well as the cannabinoid receptors are concentrated in different portions of the brain. And by and large, you're seeing a co-location of those particular receptors and those particular concentrations of receptors in those particular areas of the brain, and they're overlapping. So we're seeing opioid receptors and endocannabinoid receptors in the same areas of the brain and in the same on the same cells and co-located in the same cells. So there's clearly an interaction that's going on here.
So this is suggestive anyway. I mean, obviously through trials and individual experiences is what would validate this, but this would actually suggest, at least what I'm gathering from what you're sharing, is that whether someone's taking opioids or they're taking CBD in this case, or some type of product that affects the endocannabinoid system, that in essence it's actually having a similar, if not same, effect on the body. Is that a fair?
Well, I think that it's fair to say that there's a close interaction, that these are not independent, and that affecting one may affect the other. So I want you to hold that thought, that these are interconnected and that they're not independent. And by modulating one or the other or both, then we may be able to better control pain.
Wow. Okay, great. So it could be that a combination of the two or either or could affect pain, and ultimately it's on a case-by-case basis. Is that a fair assessment?
Well, right, based on the science, and this is just factual science of what we know in terms of anatomy and physiology that's going on. But then I want to take you to some of the case studies and the reports that we have.
Yeah.
There's really a lot of good evidence for cannabidiol specifically as a phytocannabinoid affecting pain. And it affects pain. And so we've got dozens of studies. Now, most of these happen to be animal studies. There are a few human studies. And they're all favorable results. But, really much more important, very important, Doug, is that none of these are showing adverse effects. There's no toxic effects that are being seen. Unlike the opioids that, you reach a limit, you've got respiratory depression, you've got constipation, you've got all these other physiologic problems that occur, and cognitive interference. You're not seeing that with the cannabidiol, and that's not what's occurring. And yet that's the only standard that we have it to compare to. I just have to say dozens of studies, and they're difficult to find because no one ever stands up and says, hey, I'm using cannabidiol. They tend to be, they talk about substances that are very much like cannabidiol that activate in the same way, but they may not be specifically cannabidiol. So it's all very confusing when you start to look at the literature.
Well, and I also know that part of that is as a result of the laws that have been somewhat archaic that we've had, where industrial hemp or cannabis has been cannabis itself has actually been classified as a Schedule II substance or Schedule I substance, and therefore because of that, in the United States, hospitals and medical professionals could not even do clinical trials on the benefits of what the cannabinoids within the marijuana plant would actually do. Now, recently there has been a distinction that's been made with industrial hemp between marijuana, and that's what's actually allowed CBD to be able to be sold in all 50 states without a license. People don't have to have a medical marijuana license in order to get CBD. In fact, Elixinol, as an example, freely ships to all 50 states and over 40 countries around the world. Because
in addition, it's allowed for greater research, and so there's more and more research going on. Unfortunately, it's still a scheduled drug. That hasn't changed,
yes,
and it is still restricted by the National Institute of Drug Abuse, so that the availability for doing studies is quite a bit limited, and there are very few human studies that have been done. And there are some that are starting to come out, but it's been highly restrictive. Yet, if you look at the graph of the number of studies going on and being reported, I'm seeing 3 times as many as I did a year ago.
Absolutely, and I appreciate you sharing that, Dr. Blair. I've actually been in relationship and communication with a pharmaceutical company from Israel, and in Israel they actually are allowing formal clinical trials, and one specific pharmaceutical company right now has over 1,600 patients going through trials for over, I think it's 22 different conditions. So the more and more countries around the world are starting to change their laws, and they're being more and more open to it. So I'm certain that over time, we're going to start to see these results and having more and more studies being done.
Well, the problem is, Doug, that these studies are focused on pharmaceutical grade products, which are often isolated and they don't contain the whole plant. And that loses a lot of the associations for the entourage effect that we're seeing from whole plant substances that include the polyphenols as well as the other terpenes that are involved.
Yeah, that's it. I appreciate you sharing that. So I'm curious, Dr. Blair, how have you been utilizing CBD with your pain patients? And if you could just give a bit of an overview of that, because I know you've had some pretty fascinating results so far.
Well, I have, and it's been such a shock and a surprise to me to see these kinds of responses, because I've never heard of anything like this, or that it could be as widely beneficial for individuals in terms of changing their lives. So first thing I want to know when I encounter somebody who is telling me about pain is how old they are, how long they've had pain, how big are they, and how much impairment are they encountering. So I don't want to hear from people how much pain that they're in. That's really not helpful. People tend to exaggerate or diminish their pain, and there's a behavioral sort of filtering that goes on. So that's to be ignored. The other thing that I say size, but that mostly means in terms of extremes. What I generally find is that it doesn't matter what size people are. The dose needs to be adjusted according to their particular needs. The difference has to do with children, and probably has more to do with how much endocannabinoid dysfunction that they have in their body, rather than the total size of the dose. I try to get away from, and I've learned that you can't really relate it in terms of milligrams per kilogram like we do with other things. In terms of the duration of pain, that gives me an idea of the chronicity and the likelihood of other types of problems that are going on. And age, as I mentioned, the children seem to be more receptive to lower dosage, whereas the adults can be quite resistant. Typical middle age can be quite resistant to the cannabinoids and may require a fairly high dosage for what goes on. In terms of the impairment, I'm looking typically to see what other things might be happening, like neuropathy or muscular impairment, just to get an idea of how broad their illness encompasses. I'd like to go back a slide. Okay, I also want to get a little bit more on the history in terms of diet and personal habits, and then find out what their preferences are about and decide what is the best way to take the cannabinoids that they use, or the cannabidiol, because some people will take it and they need a different variation on it. So a lot of it has to be customized about their particular need. And then the conditions to help, those vary quite a bit. So if we're talking about pain, I think we're pretty well focused on that. I can address the cannabidiol for the pain, and I have a pattern that I see pretty consistently with that. And then in all of these considerations, you got to consider what form of product is going to be best for them. You know, in many cases, you can use the cannabidiol topically so that you have an acute injury, you can apply it, or an area that is giving them particular soreness. Rubbing the tincture into the area several times a day can be very effective for controlling pain, that immediate localized pain. But it doesn't take care of the systemic pain in general. They typically require higher dosage. So there's the tincture, and elixinol also has the liposomes, which are very bioavailable and easy to take in. But you see, there are different formats that people use. Some people won't take the oils because they just have an aversion to the taste, and they require capsules. There's subtleties with each of these other things. But most importantly, you need to adjust the dose according to the need of individual. Now, when I'm starting for pain, I'm going to focus on, typically 15 to 30 milligrams and 3 times a day. Some people require 4 times a day, and other people require less. Some people are extremely sensitive, and lower doses work better. So I've rarely seen a failure working with cannabidiol for pain. The most common reason is that people give up, or they don't follow instructions, or there's no oversight, nobody's checking on them. So they try a few doses, say, I don't like the taste of this, I can't do it, I quit. And that's so disappointing because they have it in their hands. They could see the full potential for the cannabidiol, as well as the beneficial side effects that occur, but they ignore those things. I think that we, as providers and counselors, can provide some good follow-up. Will help them understand and correct them for some misunderstandings. Remember earlier we talked about pain causing a certain amount of cognitive impairment. I think that's true for a lot of these people. In fact, that's typically my attitude, is that when a patient contacts me, I figure there is some level of impairment. Now, I may perceive it or not perceive it, but rather than being their fault, I figure that it's my fault that I'm not communicating with them at their level. And so I need to do better at finding out what their particular needs are and helping them to understand the situation. Now, CBD, this is another very important thing for providers like yourselves, is that you've got to think of CBD as a food supplement, not as a drug. It's safe, it's effective, it's without toxicity, so you can use it pretty liberally. The most important thing is get people to try it and increase their dose if they're getting an effect, or if they're not getting effect, and then decrease the dose if they're having some side effect like fatigue. In terms of the conditions, in addition to the chronic pain, CBD is working on that pain sensation. But like we talked about before, the other pain medications don't really address the anxiety and the muscle tension that CBD does. And so we're seeing improvements of the anxiety, the muscle tension, the cognitive interference, to the point where I'm getting the impression that many patients continue taking the CBD with less pain control because they've got these other things that are now in control. And that includes improved sleep. And then finally, for chronic pain, I'm seeing improved mobility, relaxation, and sleep while reducing the inflammation, anxiety, and depression. And as we said, these are all very important aspects of chronic pain, but they're rarely fully addressed with conventional therapy.
Yeah, wow, great. I appreciate you sharing that. And you had some other things just as an overview or to recap to reinforce the positive benefits that we've frequently seen with CBD.
So as I said earlier, it's important to follow up with these patients. You just can't let them go. There'll be misunderstandings because this is such a new substance and a new approach, and it's a food, it's not a drug. And because it's a food, not a drug, people do some funny things, and they are cognitively impaired many times. So one of the things that you can do is, on a very close follow-up, within 1 or 2 days after they start taking the CBD, check with them, find out. And usually they will tell you that if you ask the right questions, they are having some benefits. Some things have improved for them. And hopefully the pain is improved, but for that you might have to push them a little harder to increase their dose. But look for increases or reductions in inflammation, improvements in their skin, their hair, their eyesight. Remarkably, I've seen some extraordinary improvements of eyesight where people have, after a couple months, required new glasses because their vision has improved such that they no longer can see well with their old glasses. They need to get improved glasses, and they have improved eyesight. There's a better mood. There's improved sleep. There is an increase in activity and mobility. There's improved memory and thinking, and a better performance in work and play. But if you let people to figure on their own, they will figure that it's something else that they're doing. It's their other therapies. And nobody with chronic pain comes to you with only CBD as their therapy. They have tried or continue to try all manner of different things. So it's important that you ask and point out that these things are direct effects of the CBD, and reinforce their continuing to use CBD and the benefits that they're getting.
Perfect. That's great. I appreciate that. Now, Dr. Blair, moving forward, what do you recommend in terms of just how to partner? I know we've got Elixinol has actually created a landing page for medical professionals to go to if they want to contact you or have more information about how to utilize CBD products for their practice. And I also know that we have a portal that we're building out that will continue to evolve over time, that medical professionals will have access to with specific information that we're sharing in this webinar today.
There's a huge amount of information. I think the most important thing for providers is to start being aware of the endocannabinoid system, that its connection within a number of different systems, and this underlying control that is going on, and how CBD probably affects that, and typically in a positive way. Recognize and realize that the cannabidiol is safe. You can use it in a wide range of dosage for a number of different things. I'm delighted to answer questions and provide guidance and learn about new things that are going on with the use of cannabidiol and Elixinol.
Perfect. Thank you very much, Dr. Blair.